Imagine a world where surgery meant enduring unbearable pain. That was the harsh reality for centuries, with patients forced to rely on alcohol, opium, or herbal remedies to dull the agony. Some were restrained, hypnotized, or even briefly suffocated to render them unconscious, but these methods were crude and inconsistent. Surgeons relied on speed and grit, and many patients died from shock rather than the procedure itself. The search for a better solution would lead to one of medicine's greatest breakthroughs, anesthesia. The journey began with accidental discoveries and bold experimentation. In 1772, Joseph Priestley discovered nitrous oxide known as laughing gas, but its potential remained unrealized until chemist Humphrey Davy experimented with it in 1799. Davy noted that nitrous oxide dulled pain and even mused about its surgical applications, though it was largely dismissed as a party novelty for the elite. In 1844, dentist Horace Wells witnessed a traveling entertainer using nitrous oxide and noticed that participants, even when injured, felt no pain. Inspired, Wells had his own tooth extracted under the influence of nitrous oxide, successfully proving its effectiveness. Unfortunately, his demonstrations at medical institutions were inconsistent, and his career ended tragically. Publicly ridiculed and accused of misusing chloroform, Wells fell into despair and died by suicide. The next breakthrough came in 1846, when dentist William Morton performed the first public demonstration of ether as an anesthetic at Massachusetts General Hospital. Morton's success made headlines and proved that surgery could be humane. Ether was soon adopted worldwide, though Morton's claims to fame were challenged by colleagues like Horace Wells and Charles Jackson, sparking fierce rivalries that overshadowed the innovation. Meanwhile, chloroform was gaining popularity thanks to Scottish physician James Young Simpson. In a moment of curiosity during a dinner party, Simpson and his friends inhaled chloroform and realized its anesthetic potential. It quickly became a favorite for surgeries and childbirth, famously used by Queen Victoria during labor in 1853. Her endorsement helped normalize its use, but safety concerns later led to its decline in favor of safer options. Anesthesia wasn't without its risks. In the early days, dosages were poorly understood and many patients suffered complications. Over time, safer techniques emerged, including local anesthetics like cocaine, first used in the 1880s. The evolution of anesthesia, from agony to relief. Synthetic alternatives like lidocaine eventually replaced cocaine, offering more effective and controlled options. Today, anesthesia involves a precise combination of drugs tailored to block pain, regulate heart rate, and ensure safe recovery. Beyond pain relief, anesthesia has revolutionized our understanding of consciousness. The ability to turn pain and awareness on and off has given scientists insights into how the brain processes sensation and memory. Modern advancements have even enabled surgeries where patients remain awake, using regional blocks that numb specific areas. Anesthesia's history is full of fascinating anecdotes. Ether frolics were once recreational events where people inhaled ether for fun, unknowingly paving the way for its medical use. Simpson's discovery of chloroform happened during a dinner party, turning a social gathering into a scientific breakthrough. The journey to modern anesthesia was not just about science, but also about courage, curiosity, and the relentless drive to improve human life. From the grim reality of pre-anesthesia surgery to the sophisticated methods of today, anesthesia has transformed medicine and saved countless lives. Thanks to the pioneers who took bold risks, what was once a waking nightmare is now a routine miracle, forever changing the way we understand and treat pain.